Start with a welcome. My name is Marvell Adams Jr. I serve as CEO of Caregiver Action Network, which is a not-for-profit based in Washington, D.C. with a national reach. Just really excited to bring to you today this webinar educational program on stronger memory in partnership with our good friends at Goodwin Living. Its CEO, Rob Liebreich, is with us today, along with their director for brain health, Jessica Frederickson. I will leave it to them to tell you more about stronger memory, but I will just say, from my own perspective, I feel myself lucky to have found out and learned from Goodwin Living and their leadership about stronger memory, because it really is what we see at Caregiver Action Network, the type of actionable programmatic approaches that can help caregivers right now, right today, without having much to do and at no cost. For us, this really is a great part of providing programming to caregivers, because it really allows us to have things out there that are accessible for individuals that can really help those that are being caregivers, particularly for individuals going through cognitive change. So as I said, I am CEO of Caregiver Action Network, and our organization provides advocacy, support, training, education, and resources to the over 105 million caregivers across this country. And when we talk about caregivers, we're talking about family caregivers, unpaid caregivers mostly, but keeping in mind that many paid caregivers go home and are unpaid caregivers as soon as they walk in the door for a whole host of reasons. And so as the late, great Rosalind Carter would say, there are either you are a caregiver, have been a caregiver, will need a caregiver yourself someday, or will become one. And so understanding that caregiving impacts every aspect of our lives. And unfortunately, with new reports that have come out, published not only in the New York Times and Washington Post with a study on the increase in prevalence of Alzheimer's that is expected in the coming years. And so this is even more timely to be able to have this conversation about how we can have methods for combating and mitigating the effects of mild cognitive impairment. And so before I turn it over to Rob and to Jessica, I just want to thank our sponsors for today. Our sponsors, Lundbeck and Otsuka, who have been longtime partners of Caregiver Action Network and have been so supportive of our efforts to increase the level of information, education, and tools that are available for individuals, caregivers that are caring for individuals going through cognitive change like Alzheimer's or other types of brain disease. And it really allows us not only to be better leaders when it comes to providing this type of education, but it really allows us to spread the education around very widely and allow us to reach markets that we may not have been able to reach much previously. So big thanks to our friends at Lundbeck and Otsuka. So we've done welcome and introductions, and we'll do a couple more in just a moment. And then Rob and Jessica will take us through the stronger memory journey, which I can assure you that you will be intrigued by. And then we'll do some Q&A. Next slide, please. All right. I've introduced myself, and I feel like I've done enough talking already in our first 6 minutes. And so I'm going to turn it over to Rob to introduce himself and tell perhaps a little bit about Goodwin Living and how things came together for stronger memory. And of course, Jessica to introduce herself. Rob.
Thanks, Marvell. Great to be with you. And for all the folks that are joining in today, thank you for taking time. I would like to start with just a quick moment of silence to send the love and energy to those that are struggling and are challenged both with caregiving and fires and famine and war and all those things that are going on. So if we just take just a quick moment and channel that love and energy, and then love to get started in telling you this journey that we've been on. Thank you. A lot going on in the world. So I'm Rob Liebreich. I serve as president and CEO of Goodwin Living. We'll talk more about that organization in just a second. And I also happen to be the son of Wendy Liebreich, the first person who really sparked the initiative that we're going to talk about that has turned into Stronger Memory and the movement that is impacting tens of thousands of lives. So great to be with you, and been in service to older adults for over 20 years. I have a master's in a focus in senior care and housing, and so I'm excited to be a part of this conversation with Jessica Frederickson. Jessica?
Yes, thanks, Rob. I'm Jessica Frederickson, Director of Brain Health at Goodwin Living, and a facilitator of Stronger Memory. I joined Goodwin Living in February of 2021, so almost 4 years ago, and have really just been so excited about the work that we're doing in brain health. I have my master's in social work with a focus on older adults and aging from Washington University in St. Louis. I've been on the operations side and the more clinical side, and just really love innovating and providing education on dementia support. So really excited to dig in today. I'm going to hand it back over to Rob to talk about who Goodwin Living is before we really get into the Stronger Memory program and the origin.
Thank you so much, Jessica. Goodwin Living is a faith-based not-for-profit. We were started in 1967. We serve about 4,000 older adults in the Northern Virginia, D.C. area. And then we serve tens of thousands of older adults through our brain health program, Stronger Memory, which we're here to talk about today. Our mission is to support, honor, and uplift, and I hope you get a sense of that. If you're ever interested to learn more about our organization, goodwinliving.org is a great place to find out more. And all throughout this presentation about Stronger Memory, you can also go directly to strongermemory.org to learn more about that program directly and benefit from it as we're going through our details. So as an organization, we do operate housing, but we also have services. So we have 3 communities that we own and operate, 2 that we support with management services. And then we also have home and community-based services from people choosing to live at home all the way through certified home health, rehabilitative services, and hospice services as well. And this is one of my favorite slides. For those of you that are joining us, you probably already know this is happening. There's this huge growth of older adults that are occurring at this exact time. In fact, in 2024, we sort of hit the peak. Oftentimes, we would hear that 10,000 older adults are turning 65 every day. And towards the end of 2024, we actually had 12,000 individuals turning 65 every day. So we are growing and seeing this growth continue. It will slow down a little bit, but the growth overall will continue for many, many more years to come. We're in essence doubling the number of older adults in our country, and this is amazing. It's something to celebrate. It's a big deal. It's a positive deal. We love that this is happening from our vantage point. At the same time, we are also seeing a real change in the number of babies that are being born in this country. We're actually, just last year, we had the lowest birth rates we've had in 100 years. So this is not very helpful when we have this huge growth of older adults, but yet we have a shortage in the talent and in our population in terms of young people. So as people are getting older, they're going to need more support, more services, yet we're losing out on the ability to have enough hands to provide that care and service. Our focus then becomes, how do we prevent the need for care for as long as possible so that we can keep people away from facing this challenge, that we don't have workforce, yet we have this growing aging population. One of the things we note as people are getting older is that a number of folks are challenged with dementia, Alzheimer's, or even a precursor to those things, which is called mild cognitive impairment. This is often an indicator that maybe 5 years from now, you will be heading towards dementia or full-out Alzheimer's as one of those types of dementia. And you start to recognize things about yourself. You're still able to operate independently within your space, but maybe you're getting a little bit more forgetful, and it's not what usually has happened to you. Maybe the things that you were doing normally cognitively with your brain health were getting a little bit harder to do on a consistent basis, and you're finding yourself withdrawing from some of those activities that you used to do. So oftentimes this mild cognitive impairment phase is a really important part of recognizing, okay, my brain health is changing. What about it can I change? Is there anything I can do in this moment? And that's why we're so excited to be with you today and be able to share a bit of our story with the Stronger Memory program. So this is a picture for those of you who've been on the architectural tour in Chicago. This is my mom and I back many years ago doing that exact tour. And in 2011, she was married, still is, celebrating many years of marriage with my dad. 3 kids, myself, I'm the youngest, 2 siblings, older siblings. And at the time, there were 6 grandchildren in the mix. But also at the time, my mom was starting to be forgetful. She was starting to repeat herself, and she was getting lost in familiar places. This was really scary as she was driving about. I remember growing up with friends in high school whose grandmother didn't remember where she lived. And in a snowstorm in Oregon, she ended up passing away because of the elements, and she just never could find her way back home. So when I started to learn about this from my mom and my dad, I was really nervous for where she was at. Now, again, she was able to live independently with the support of my father. And, so she wasn't needing care at the time, so to speak, but certainly rapidly heading towards that journey. And we'll give you a sense of where that journey started from her perspective and my dad's perspective.
What I first noticed was that she was repeating herself many times within an hour, 2 hours, and not remembering what she had just said. And that was really frustrating. And it was hard to broach her on that because I didn't want to upset her. And so I actually, I think I talked to Rob first, and he indicated that I should talk to her. And when I did talk to Wendy, she said, "Gee, I didn't realize that," and she became very concerned about it and took it very seriously and really wanted to do something to get out from under this problem that she was having.
I think that I knew that I was in a different place. I knew that I was having problems that I wasn't really understanding. So I felt like I lost my number ability. I couldn't multiply, add. I would do it under the table. So I knew that was an issue. I also was having a lot of trouble just recalling. I felt that my focus definitely was being challenged. I was looking for my phone, my keys. I'd put things down, couldn't remember where they were. I think the thing that really scared me was I was driving one day and I was so mixed up going to a place where I've been before. And I am directionally challenged already, but this was alarming.
So what you heard Wendy talk about there was, and Howard were really there first noticing and really hearing her story. Her story motivated Rob to go do some research and find something that could help not only his mom Wendy, but that could really be shared all across the country and all across the world. So that journey has led to the creation of Stronger Memory, which is a program designed to help those facing mild cognitive challenges, an early diagnosis of dementia, or even people who just really want to focus on improving and maintaining their brain health as they age. There's simple activities practiced daily that engage the working memory, and they trigger brain activity in the prefrontal cortex, the part of our brain right behind our forehead, which research shows can help stabilize and improve cognitive functions. And we'll get into some of the specific research we've done a little bit later. But just to quickly show, what are the stronger memory exercises? It's 10 minutes of each exercise, about 20 to 30 minutes a day total for at least 5 days a week. And these are really simple. We're getting back to the basics. So reading aloud, writing by hand, and doing simple math problems quickly. This is what works that part of the brain behind our forehead, and we know that it works both hemispheres of our brain together. So we're really exercising that recall, exercising that working memory, the things that help us with remembering names. We walk into the kitchen. Why did I come in here? Oh yeah, to get something from the cabinet, whatever it might be. Those things that really help impact our daily working memory, focus, and recall. So this is what was created and what we've been sharing, what we're here to share with you today. I'm going to hand it back over to Rob for a moment to talk about where Wendy's at now. We heard about Wendy in 2011, 2012, when she just started working on this. But Wendy's still really active in stronger memory today. And Rob is here to share her story.
Yeah, great. Thanks, Jessica. One of the great joys I have is the fact that my mom, 12 years later, 13 years later from her diagnosis of mild cognitive impairment, ends up being cognitively strong and capable and able to engage. And so fast forward now to 2025 and still 3 kids, now 9 grandchildren, and able to really interact. Actually, my parents are traveling together. They've been taking some vacations together, and they're just amazing. They're in their early 80s, and they are exploring and having new adventures together. At the time, back in 2012, when my mom started these exercises, we found that within 30 days, and this is traditionally typical for those that take this on, that within 30 days, you can see some real transitions and changes in the brain, in one's brain health. So for my mom, she was able to have much better focus. Her repetition in repeating what she was saying really went down, almost went away. Her forgetfulness also dissipated tremendously. And although she still is directionally challenged, and I think I also received some of that from her, she's not directionally challenged in the way of getting lost to a point of fear. And that's a major, big deal. In addition to that, she's been able to play a lot of bridge and actually teach bridge to others. She's able to engage with her grandchildren in a variety of different ways, including writing stories with them back and forth, which has been a fun journey with her. And then she's been on the public speaking circuit, getting the word out. And if any of you want to welcome us for a webinar to your organization or people you know around you, we'll welcome that opportunity. We want to share her story. She wants her story shared so that as many people as possible can benefit in the same way that she benefited from the knowledge of these 3 simple things with no side effects, being able to change her complete trajectory in life.
Right now, I'm overjoyed. I think that since I've gotten involved with Rob's new program, Stronger Memory, and I've been focusing, I feel like I'm back in school actually, because I'm doing homework every day. I never let it go by. I might fall asleep while I'm writing my diary, or sometimes my mind floats off because I'm still trying to multitask, which I've learned recently that that's not good for your memory. And so I think that I can see the difference right now. I would say I have the best focus and recall right now that I've had in the 11 years I've been doing this.
Yeah, talking about recall, her recall has become so good that she recalls things that I don't wish her to recall. No, but seriously, she has an amazing recall that has improved significantly. I mean, this is much better than it was even before the 11 years ago when she started this. She's amazing. Her recall is far better than mine now, and I think it's because of the program she's been on.
So you've heard from Rob, from Wendy and Howard about their amazing experience with this program. And we have heard countless other stories of similar experiences. We don't just have stories, we also have some data. So really exciting news when looking at the research of stronger memory. When Rob created this, it was informed by research of these same exercises being done with people who had more advanced dementia. And Rob thought, let's bring this upstream. And we've really been able to validate that bringing these types of exercises into play earlier in someone's cognitive journey when they just have MCI like Wendy, or even before when they have a relatively healthy brain, this can still have a great impact. So we've partnered with George Mason University now on several studies. Our biggest study was conducted in 2021 and 2022. And this reported, this had participants participate in pre and post testing before they started the program, and then 12 weeks later. And this involved a mini MOCA, or the Montreal Cognitive Assessment, which is really high validity, something that doctors use, social workers, clinicians can use. It's used very often. And what they found was that compared to the pre-program scores, after 12 weeks of doing stronger memory, they had better total cognitive scores, and specifically better scores on the recall portion of that test. So it tells you kind of which brain area is being tested, and specifically we could tell that the recall portion was what really had the most significant improvement, which is great because that's what we're trying to do. That study was 102 participants, and what they found was there were about 18 participants within that 102 who scored as having mild cognitive impairment on that mini MOCA. And what they found was that with those 18 individuals who had MCI, there was an even more significant impact, a 26% improvement in their mini MOCA scores from before they started the program to after. And what this means is people were moving from scoring in that range of likely having MCI, which means there is some significant impact on those things like being able to cook a meal, being able to drive and navigate where you're going. They were scoring in the healthy brain range after doing stronger memory. So you no longer had the symptoms of MCI, but now you were really doing something that put your brain in that healthy range, which is exciting, right? Because we know there's not a cure for dementia. We're not trying to say that this is a cure, but it is something that can help improve those symptoms and delay that need for advanced care, delay the need for more serious measures if we can keep brains healthier longer, promote that independence.
Jessica, I know you're going to share a little bit more about the process and information. I just wanted to interject. Last night, I received a testimonial from Seattle area, Redmond, Washington, and a couple that had they tried to move into a community, but during the community's assessment, the wife was not able to pass the cognitive test. She was coming with some brain fog because of some medication. And she was really not able to get through that. And so the sales team there actually presented stronger memory to them and said, why don't you come back in 30 days? And so the couple just did exactly that. 30 days later, the wife was actually, really focused on doing the work every day of stronger memory. And she was able to increase her score dramatically from the first time to the second. And now they're able to move into the community. So a really good positive indicator, very consistent with the research of George Mason and certainly with my mom.
Absolutely. That's incredible. Along with that study, GMU has also done a lot of focus groups with these research participants, and they published a qualitative article on that data in the Families and Society Journal of Contemporary Social Services. That was published October 28th in 2024. And the most valuable insights that came out of that was really around motivation. And so you can see the title of their article is actually this quote that's in the corner here from a participant that said, "I have decided to read aloud for the rest of my life." And we really learned a lot. The motivation for people to join, there's some concern about memory decline, a desire for prevention, curiosity, people want to pursue their hobbies, or there's a family history. But what was identified as that motivation to continue is really seeing this improvement. And we have a model with stronger memory that it's something you can do on your own, especially with a spouse or a friend, a family member, but it's also something that you can do in a group. We have set up where there's lesson plans. You can come together, read some brain health education, and really come together with a group to encourage each other to keep this habit going. We recommend, starting that group for at least 10 to 12 weeks. And a lot of people found encouragement from those group settings. And some people said they talked to their medical professionals about what they were doing for their brain health and how it was helping. And their medical professionals said, yeah, that's great. Keep doing it. So this community around stronger memory is something that's really wonderful to be a part of and really helps people stay motivated with this brain healthy habit. Our community is large and growing. Our goal is to reach 100,000 lives, and then we'll do a big celebration and keep going. We have partnered and shared stronger memory around the country with individuals since spring of 2021. Our first partner was the Village to Village Network. We've also partnered with organizations like Sibley Senior Association, Leading Age National, and you can see there's several standalone assisted living and memory care communities, senior housing communities. We partner with the Parkinson's and Movement Disorder Alliance, with the Maryland Department of Aging, and we received a grant through CMS. It's a 3-year grant, just about finishing our third year up of that grant in June of this year, but that was to share stronger memory in 100 nursing homes throughout the state of Virginia. We're in almost 75, and we've shared it with 750 individuals just through those nursing homes alone. So this is a great community to be a part of. If you're interested in joining the Stronger Memory community, we have really easy facilitator trainings. We have all of the resources and a monthly call that is just for sharing of best practices. I learned so much from those calls, and it's really wonderful to hear the impact that this is having. Some of those quotes are here. Stronger memory made me happy. People say they feel energized by the math, and that surprised her. She hasn't felt that energized about anything in quite a while. In the Stronger Memory Workbook, we have writing prompts. We have the easy math, because it's hard to find simple math for older adults. So one of the comments here is about those journal questions that are in the workbook. We have about 200 writing prompts in the workbook and some supplemental packets. And this participant said, the journal questions sparked good memories and very good conversations between us. Sometimes she just writes one sentence, sometimes several. but it has produced some good brain activity. So that, someone at one of our campuses was just talking to me yesterday about her husband actually started doing stronger memory, just the two of them. And at first, he started just writing a sentence or two to those prompts, but now he's writing a whole page, and they're connecting on stories that they haven't talked about in a while, or they're looking at old pictures and connecting and writing things down. So it can be a wonderful way for caregivers to connect with their loved one. Another participant said, I've been motivated to write about my life, to pass on to my children, grandchildren, and great-grands. And then this last comment on here is from somebody at one of our partner organizations who said, one gentleman and his wife went on a picnic, discussed stronger memory, and decided to begin reading aloud to one another. And they came back to the senior center staff and said, reading aloud has brought a closeness and intimacy back between my wife and I. So it's really, the magic is in there's magic backed by science, but the magic here is in the exercises themselves, that reading aloud, writing by hand, and simple math, doing those for about 20 to 30 minutes a day, at least 5 days a week, along with some sort of social connection, whether you're just talking about it with a friend or doing this as part of a group in your community. Lots of different ways to engage, but the secret sauce is really when both of those pieces come together. You can download our free Stronger Memory workbook in English or Spanish at strongermemory.org. And you can learn about starting Stronger Memory in your community or ask us any questions by emailing strongermemory@goodwinliving.org. Before I break for Q&A, though, I want to pass it back to Rob to see if there's anything that you want to add before we move to Q&A.
Yeah, I think one of the things to reference, and Jessica, thanks for sharing and doing such a nice job of sharing the background and the research elements of this program. There is no reason not to do it. It works well for so many people. You'll find out over the course of 30 days, so it's not instantaneous. Sometimes we have people who find out as soon as 2 weeks that their brain is starting to operate in a different fashion, but typically it's at least 30 days. Once you hit that 30-day mark, you should be able to see some real change in results, or at least the people around you, maybe you as a caregiver, will see the results. I also would say that this is best done with others. So if you're a caregiver for someone, it's not to give that person homework. It's to do it together, so that it's a journey together, that they're helping you be better. And I think that's really, really important. Don't forget that we're all in this together. We're working with people first, not diagnoses. And so being able to use a tool like this, and we've tried through the generosity of the donors to the Goodwin Living Foundation, we've tried to make this absolutely at no cost for you to engage with, download, share. We would love if you have people in your communities that you want to start up programs with, to start weekly discussions. We have a number of those programs going on for years now, where one individual said, oh yeah, sure, I can host, and start the conversation. And all of a sudden, years later, there's a handful of folks that are still coming together, engaging, talking with each other about what they're doing for their brain health, encouraging each other to read out loud, encouraging each other to do the writing, encouraging each other to do the math, learning about new things that are going on with brain health, which is something that will help provide any facilitators out there that want to jump in with us. Our goal is purely to push off the need for care for as many people as possible. And then recognizing that this journey for us started more upstream with my mom with mild cognitive impairment. However, Jessica referenced our work in nursing homes. That is coming back into an environment with people who have severe dementia. And so someone on this webinar may be thinking to themselves, gosh, is it too late? And our experience is to say it's never too late. We really can see amazing changes in people, even who in essence have been catatonic in a way. All of a sudden they get involved and they start small. You start small by identifying a number. Maybe they're not doing math, but they're doing numeracy, where they see the number 1 and they can point and identify that. Maybe they can read just 1 word or 2 words. So that's a big deal. And getting started is the key. And maybe you're not going to start with a full 30 minutes a day, and that's okay too. Maybe you're going to start with 5 minutes a day and work your way up to 10 and then 20 and then 30. That's perfect. And we encourage you to get started. The hardest part about the habit of doing this work is to get started and to continue to do it as frequently as you can every day.
Yeah. Thank you so much. We're super excited to be here with the Caregiver Action Network. So I wanted to put up this slide that has their help desk number. And then we will go into Q&A. So I will hand this back over to the CAN team and probably stop sharing my screen so you can see all our faces, unless you have other instructions.
No, that's fine.
Great.
Awesome. Rob, Jessica, thank you so much. I've heard you guys present on this more than one time, but each time I feel like I learn a little bit more and am even further intrigued by just how impactful and how quickly impactful that this can be. And just understanding that these types of interventions and, quite frankly, proactive approaches you are so uncommon for any disease condition state, but particularly when it comes to cognitive impairment. So thank you so much. Just as a heads up before we start doing questions, I see there are some in the chat. This will be available on Caregiver Action Network's website, I would, as well as most likely Goodwin Living and our YouTube channel, so you won't miss out if you have others that want to participate or find out more about it. So with that in mind, I'm not sure if Nicole or Paula or Jody would like to help us with the chat questions, but we could certainly try to get through some of them.
Sure. I'm happy to bring up a couple here in the chat. And I know for folks that have been sharing it in the Q&A feature, I know that we've been getting you some responses. So if we have time, we'll go back to those as well. But I think everyone should see those. So one of the questions in the chat is, would this be a good program for COAs to offer for groups?
Yeah, I mean, I think this could be a great program to offer for groups. This is really helpful. Each group can kind of function a little differently, and we provide free training for facilitators and can walk you through that. So whether your group is more interested in kind of that education piece, there is a portion of come learn about the brain every week. And we provide those lessons or short articles that you can read aloud together and some discussion questions. And other groups really are more, almost more like a peer support group. So if your group is more interested in talking about the exercises, highlighting what did you write about to this writing prompt. It's really a great way to learn about people, learn things you might not have known otherwise. And I just learned earlier today in one of my groups that one of my participants was an ambassador to Norway. So you always learn something new that doesn't come up. So it's a really great way to build connections and empower people. Yes. I see a question in there. What does COA stand for?
Yeah, it's a good question. I'm not sure I know what COA stands for either, but maybe the person who wrote the question can answer that. I'm sure it's a caregiver, some type of caregiver group in particular. I would just say the additional research. Oh, Council on Aging, of course. Yeah.
Council on Aging. Okay, that's what I thought, but I was like, let me let the person who
okay, perfect. Yeah, we've worked with the National Council on Aging and have rolled this out through a number of AAAs and been able to agency on aging.
Yes, area agencies on aging.
And so we've done that with a number of senior centers. You saw a reference to Maryland. We've rolled it out to nearly 50 senior centers in Maryland. We're rolled it out in Utah, Virginia, a number of places throughout the country. If you have Nevada, so if there are places that you would like us to work with, help us make the connection, we'd be happy to follow that up. And I would just also indicate that the additional research that's been done by George Mason, there was a study, a continuation study done with around socialization of the program. So it brought in people, both actually Korean speaking and English speaking. So it changed the language side of the equation. But for both cohorts, they both benefited from the Stronger Memory program in terms of cognitive improvement, which was great to see. And then the groups that had a social connection, so once a week they would really come together and do the work, they showed even greater improvement in their cognitive abilities. So not only the benefit of the cognition improving, but certainly the socialization improving. And that's a big deal for everyone right now.
Thank you so much. And I think that touches on the question that was asked about kind of the study portion. Any challenges that you encountered and what was the approach? So thank you for kind of giving that foundation.
Well, actually, Nicole,
Absolutely.
one of the exciting things about the work on the study side, the research side, is that there's been a longitudinal review as well. So, it's one thing to review when you do the program, which is what Jessica was talking about, 102 individuals that were studied across the country with a pre-test and a post-test. Then we went back to that group of the 102 over 6 months later after they had done the program. And they checked in with those folks to see, are you still doing the program? And then they also did another test to see how their cognition was holding up. And what was fascinating was whether you were doing the program continuing or not, you were not backsliding to your previous score. So if your previous score was, down here and you went up here once you've done the program, you weren't coming back to this level. You were staying closer to your post-test score. And that's really, really intriguing. For those that were actually continuing to do the work continuously, their scores actually improved even further. So good news either way. Once you do this work, get through and try it for 12 weeks, we have great confidence that you will see improvement and that you'll be able to sustain that improvement ongoing, even if you don't continue after the 12 weeks.
I know that we've talked a bit about utilizing this program within groups, but we did have a question in the chat from someone who was asking about its availability for individuals.
Yeah, absolutely. So we have the full workbook available online. You can download it for free, and we have that in English and Spanish. That has the math, it has the writing prompts, and just some tips and instructions for reading aloud, because we really feel you should read aloud something that you're interested in, something like you already read if you read the newspaper, pick an article out of that to read aloud. And we do have that facilitator's guide available for free as well. Even if you're an individual, but you want to read more about what the program is. We do sell the workbook. We just sell it for a pass-through cost if people want the printed copy. But it's on the website as a download so that you can freely download it and print it yourself. I will say a lot of individuals might download it and only print off the math sheets and then use a notebook for writing your answers to the writing prompts. So we want it to be really, really affordable. You certainly don't need the full workbook printed out. It's just a tool to use for these three exercises.
Yeah, I would just add to that as well, Jessica. I think one of the great things for individuals is to download the program specifically. And when you do, you'll be given the option to sign up for a daily email that turns into a weekly email. So one of the hardest things about any habit, working out, eating right, whatever those habits are, it's really hard to stay consistent with those habits unless you have someone prompting you along the way. And so that's why we love when groups come together. I see a reference to Bainbridge, Washington, which is great. Love to have the program out there, and active senior centers is perfect. So when people are alone, though, they really could benefit by downloading and signing up for the daily messages, which gives you a encouragement, a prompt, some additional information, trivia, if you will, about the brain health. And then it turns into a weekly message just to try to keep you going for the next several years. And we think the utilization rate of those emails is really high. People stay with us and once they get them. So we encourage people to sign up for those messages along the way.
Fantastic. I know that there are now, I'm going to switch gears just very quickly over to the Q&A feature, as I know there have been a couple of things that have come in. And Rob, I think that you had indicated that you wanted to answer the question that had come in. And there's kind of two in here. Again, talking about facilitation within a senior living facility and its usefulness, but then also going more into the content, which I think is a great area to delve into. What topics seem to be popular with most writing groups?
Yeah, Jessica.
Rob, do you want to answer the one that you raised your hand for first?
Yeah, I'm not sure I knew what I was doing when I raised my hand for that one, but it was just more of a high five to Ann Wilson. We think it's absolutely amazing too. We think the brain is absolutely amazing. I think for me and for many of you that have come to this webinar or listening to it post, hope is really hard to find when you are faced with the challenges that you or your loved one is faced with. And this is one of those moments where you can have hope. You can actually do something and do something that within 30 days, you'll know whether it has a positive impact or not, assuming that you stay consistent with it. It will help you. It will help the one around you. So it's something that has a lot of potential. It may not work for everyone, but it works for so many. And it seems to be something, it's fully accessible. There's a question about, how do you determine the topics for reading or writing? It's really your choice. We've tried to provide some guidance and we've said, read what you want, just as Jessica said, whatever will get you reading, that's what we want you to read, reading out loud in particular. My mom today has a number of friends that she is reading partners with. They choose a book, they get together and they read to each other back and forth. And it's amazing what happens when you start reading out loud to someone else. They notice things that you would never notice if you were reading silently to yourself or even out loud to yourself, I dare say. So find something that works for you. I remember early on, we had a resident who said to me, gosh, Rob, your program's great. I'm so glad for your mom's journey, but I don't have any issues, so I'm not going to do the program. And then she went on to say, however, I do read the Bible every day, and I started to read it out loud. And I have to tell you, my focus is so much better. That's it. That's all we're looking for. We're looking for people to jump in and try this, to work on it. And as soon as they do, you find successes. Just by that example as well, I think you recognize that if you can't do all the parts, right? Some people have a hard time writing, for example. We still would encourage you to do the reading out loud and the simple math, even by going through the problems and saying the answers out loud. So if you can't do all three parts, we say do as much as you can for as long as you can. You'll still get, we believe, the benefit over time. And we really encourage folks to take that on.
Yeah, absolutely. And just to answer a little bit more of the questions around writing topics or reading topics. So with writing topics, I've had participants who really want to just journal. They just want to journal. That's a pretty popular one. I have a few unique participants who just want to write about that one thing that they love. So I've got a participant who writes, he was a Navy officer. He's actually written a couple books, which I didn't learn until a couple of years in working with him. But he likes to write about Navy policy and procedures. So you're going to have people, and the program's designed to really be specific to your culture, your interests, your profession. I will say what most people enjoy, though, about the prompts that we have created, which some of them are created by us just brainstorming, but we've also had probably half of our prompts suggested by other participants. They're really unique questions and questions that make you think back to a memory. So one of my favorite ones to ask is, what did you do with the first dollar that you earned, your paycheck from your first job? And there's no right or wrong answer. That's kind of the key with these writing questions. They're open-ended, but it gets you to think, what was my first job? Was it babysitting? Was it, working in the office? What was that? And that can be really helpful. And people share that they think of things they wouldn't have otherwise thought of, because those questions do kind of talk about your history, but in that really open-ended way. And we're always happy to get feedback on our writing prompts and include any additional ones. Probably every year or so, we go through and we ask a bunch of our participants and facilitators, hey, any writing prompts you think we shouldn't include anymore? Any ones you want us to add? So we're always trying to evolve. And certainly with the reading aloud, we don't prescribe reading materials. We have done around holidays like Mother's Day and Father's Day, suggested some books written by some, famous women, written about family, written about a male mentor you maybe had. We might suggest some of those as a supplement, but really it's very very self-directed or group-directed, because you're going to know the people you're caring for. You're going to know the people in your group best. So we want you to be able to customize that.
And we're seeing some questions about whether if you can't write, is typing okay? So the research is fairly definitive that the handwriting part is what is most effective. If you're not able to do that, and in some cases, we've had a number of folks coming back from strokes, for example, other challenges that it takes more time to write. It's getting started and just doing as much as you can would be our first answer. Our second answer would be, okay, well, if you can't write, at least type or voice into your phone or computer and talk through what you want, and then read that out loud, right? So at least if you're not going to be able to do the writing outright, turn it into a reading exercise out loud. That's a way to come around it for sure. And then
and just to add off of that, Rob, to share, I always tell people, make it a social activity. So while writing or typing you might be doing on your own, if you're not able to write, then make it a social activity, partner up with someone, talk about your answer to those writing prompts, so that you're getting that social benefit as well, which we know is great for the brain.
Perfect, Jess. I love that idea. Keeping the social as much as possible is such an elixir for so much. So I also note a question in the chat about math and accounting, if that would be okay. That's my dad's answer. He's always on doing stock market stuff and this and that. He's like, well, I'm always looking at numbers and I go grocery shopping and that's enough. The reality is that you have to be intentional with your time. And the reality that we experience is that you have to do the simple math, what I would call low anxiety or no anxiety math. In fact, in the math program that we provide, the worksheets that we provide, we don't have any answers to any of the questions. The reality for us is that we don't need you to get the answers right. We just need you to work through doing the problem. And that seems to engage the brain in the right way. Now, my mom, super competitive, wants to get everything right. That doesn't work for her. So she makes sure that she has the right answers best she can at the end of the day. But for many people, it's just about doing the problems. And you can do whatever level of math problems you like, as long as the anxiety level of doing those problems is low. As soon as it becomes like, oh my gosh, I missed this problem or I can't figure this out, that's when the benefit of the program actually turns. So you don't want to go too far with your anxiety. Low anxiety, do it fast. More important to have a timer with you so that you're checking on the time and working on the speed of processing within your brain than it is to work on harder math. This is what we found with the program. Would really encourage people. It's hard to do simple math quickly, ongoing, but you can also compete against yourself. We really encourage folks to start doing it day 2, do a benchmark within the workbook, and then come back 2 weeks later, come back 2 weeks later after that and see how well they're doing in terms of the results and the timing it takes to get that work done.
I know that one question just came in, and it is around a spouse that's been diagnosed with stage 1 cognitive impairment? And is this something that would help him? Would things like reading out loud benefit?
Yeah, absolutely. I think that's where we really see the most the most visual benefit, where you can really feel the biggest benefit is in, and the research backs that up too when we did the pre and post testing with George Mason. But these three activities of reading aloud, writing by hand, and doing the simple math really help those symptoms that we see. The focus, the forgetting, helps with recall in that early stage of dementia or mild cognitive impairment. So it's certainly helpful at all stages. We found different results in all the different stages, but it does seem to really visibly impact that early stage cognitive impairment. Absolutely.
And because that person asked the question came in late, just a reminder, it's best that you don't just hand over homework to the person that is struggling.
Right.
That won't be effective. What you want to do is say, hey, I'm starting to read out loud. Could you read with me? I'm starting to write answers to these questions. Could you write with me? I'm starting to take on these math problems. You want to challenge me and see which one of us can get these done in a fast way, right? You start to do it together and you keep it as a together activity. That will keep the person engaged so that they're helping you, not just them being focused on.
Yes, absolutely.
All right. Any other questions hanging out there, Nicole? This has been like amazingly engaging. So glad to see everyone so engaged and just conversational about this. I mean, it's a topic that, quite frankly, touches so many individuals, and to have at your fingertips potentially something that can really be impactful, just amazing to see. So, Rob, Jessica, I want to thank you so much for taking the time. You guys, Rob, from your personal story to the work within the Goodwin Living Foundation and being able to really showcase this to the world at no cost is just such a huge benefit to caregivers and individuals going through cognitive change. So thank you so much. We really appreciate you. And I have a feeling we'll be doing more together. So looking forward to it.
Grateful to the Caregiver Action Network. Thank you for the opportunity, and it's been a blessing to be with you all today.
Thanks so much.
Yes, thank you so much, and thank you for all that you do at the Caregiver Action Network.
All right, appreciate it. All right, take care, everyone. Thanks so much.